Hey, it's Dr. Stuart Rammell with Pinnacle Pain and Spine. Today I want to take some time to talk to you about an interesting option for treating low back pain, something called peripheral nerve stimulation that is used temporarily. Now, low back pain can come from multiple sources, but one of those sources can actually be when the stabilizing muscles of the low back become weak. Now, using a temporarily inserted peripheral nerve stimulation system, we can help stimulate the small nerves that are taking motor function to those stabilizing muscles and help reactivate them. And this, in many patients, can actually help reduce back pain. Many patients who have had success with this therapy are patients who have previously had other injections to help treat pain that's coming from the small facet joints in the low back. Right here, they're the connecting joints between each vertebral segment in the lumbar spine. So people who have previously had injections into those joints or have had a radiofrequency ablation procedure, but kind of over time are seeing that procedure isn't being as helpful for them, are patients who would actually be really good candidates to undergo a temporary peripheral nerve stimulator system to stimulate those small sensory nerves that are going to activate the small stabilizing muscles in the low back. This is an interesting option in that it's not a one and done procedure like many of the different spine and joint injections and ablations that we do, but something that we insert these peripheral stimulation leads onto those nerves, and then patients wear the device and use it every day for 60 days, and it will help to reprogram the stabilizing muscles in the low back. At the end of the 60 days, the temporary stimulation leads are just simply pulled out of the low back, and studies have shown that people not only get benefit from this during the time that the system is implanted, but they also get much longer prolonged benefit afterwards. Studies showing even at 14 months after the initiation of therapy, patients are still getting significant relief. The way that this procedure works is there are small nerves that can be identified under a live x-ray in the lumbar spine, and we drop an introducer needle down onto each of those sides. Once we know that we're in the right space, we'll put a little stimulating electrode in there to make sure that we're activating the stabilizing muscles, which we can verify with an ultrasound machine as well. And then we place a small electrical lead through that introducer needle and then pull out the introducer needle over it, leaving the small electrical lead in place. Now, the small electrical lead is about this size. It's made into a coil, so it has give to it, and then there's an active portion of it that sits right on to where that nerve is, and we can deliver stimulation therapy to it. Generally, we start patients with doing it for 6 hours a day and then gradually increase them to about 12 hours per day. And when patients do this for that 60-day period, then we can see a drastic reduction in patients' pain and an improvement in their function as well. One of the nice things about this procedure is something that's temporary. It's not something that you have to have in forever, or something that would need to be explanted through a surgery. The placement of this is very minimally invasive. Just 2 small introducer needles through which we pass these leads, and then everything comes out. The potentially difficult part of the therapy for patients is that they have to have this externalized system in for 60 days. We try to make it as non-cumbersome as possible with the small leads, and then we use a waterproof dressing that we place over where those leads come out, and then patients wear a small external battery that's taped on to the other part of the low back, which can be changed out. The battery can be taken off during showering. You can shower with the waterproof dressing on during the period. We only ask that patients don't submerge in tubs or pools during the period. Now, when patients follow that treatment recommendation to doing the 6 to 12 hours a day for 60 days, many patients see drastic results in, like I said, the reduction of their pain and the improvement of their function. So for me, this is a very minimally invasive option that is a short-term treatment, no permanent implantation. I see mostly only upsides to this, despite the small inconvenience of potentially having to, deal with having this externalized system. I think that it's an excellent option for patients, and it's something that I'm happy that I can offer patients, and I think that we can get some good results with it. So if this is something that we've talked about in clinic, like I always say, and you're getting ready to go through the process of implantation, then of course, best of luck. I hope this is an excellent treatment for you and we're able to get you back to enjoying your life. And if you have back pain and we've tried other things and we're not seeing the results that we want, this is something we should talk about. If you've seen other doctors, whether they're pain doctors or not, and you've tried other interventional options and you're not seeing results, or if you simply just want to do something that is, non-destructive, non-permanent, then this is something we should talk about. So come into my clinic and let's sit down and discuss this option of temporary peripheral nerve stimulation to treat low back pain.